Good evening, Boss Fam. Welcome to Real Talk Houston. I am Carlotta B. This is season 4, episode number 5. We are here at the town hall meeting. This is town hall meeting number 2. And today we have James Guillory. He's a Democrat candidate for Texas State Representative District 131. I want to say thank you to the Metis Center for having us here today. And then thanks for everyone who came out to join us, as well as those who are joining remotely via Zoom or Google Meet. Today we're going to cover a topic of revolutionizing healthcare. We've collected a few healthcare related questions prior to the start of the town hall broadcast, and Mr. Guillory is going to answer those questions and concerns for us tonight. Today's show is sponsored by James Guillory for Texas Campaign 2024. So thank you for that. We appreciate it, and we're happy and elated to be out here today to address some healthcare concerns. Keep in mind that we will be hosting a few more town hall meetings, and we will have different topics that are plaguing the Houston community. I want to start out by reminding you guys of a few voting stats that exist here within District 131. There are 200,000 constituents in District 131. Only 91,000 of them are registered to vote. There's a big gap there, you guys, so we definitely need to close that gap and get more people registered to vote. Only 12,000 constituents voted in the primary election, and only 33,000 voted in the general election for Texas State Representative. The current incumbent, Ms. Allen, has served 11 legislative sessions, and that's equivalent to 22 years. Again, that success rate for getting laws passed and bills passed is 6%. So if you guys want to increase that rate, let's talk to James Guillory, and we'll see what he's going to do to increase that success rate. Mr. Guillory's slogan is "Together We Will." So I'm here to moderate the town hall meeting today, and we're going to peel away some layers and see if he's our man, right? So you are the change for District 131?
I am the change, and thank you so much for having me. I really appreciate it.
So let's talk healthcare, Houston. Let's talk. Yes, thank you guys so very much. So let's go ahead and get into it. I want to ask you some questions about healthcare and how you're going to bring change to the Houston community relative to District 131, what your plans are on making that happen. Because we definitely need change. So let's start out. Let's go ahead and get started with the questions. What measures do you think are crucial for ensuring healthcare accessibility for marginalized or underserved populations in the community?
Thank you, Paulina, for the question. Let me also start off by saying I have no healthcare background. Mm-hmm. My education is in accounting and business, and been in business for myself for 26 years now.
Okay.
But like everyone, I've dealt with health issues within my family. I even had asthma and seizures when I was a little kid, by the way. So okay. I've overcome a few things. But as your state representative and as the state representative, one of my jobs will be making sure that the hundreds of billions of dollars that come through the state of Texas is properly directed for use for those healthcare entities, healthcare programs, mental health programs that are within our community, especially throughout Harris County and Houston, Texas, and through the state of Texas for sure. You mentioned the marginalized communities. Mm-hmm. One of the things that Greg Abbott and Dan Patrick, our Republican leadership, have not allowed to be utilized and utilize the resources that we have even coming from the federal government is expanding Medicare, Medicaid, which it is actually a very popular request, and it's coming from our voters. Over 75% of the voters have already made it known it would be a very good idea. Unfortunately, we have a governor who believes that if you need insurance, you should get it through your job. However, over 50% of the jobs that we have in the state of Texas do not provide health care coverage. Many companies below 50 employees do not provide health care coverage. We really benefit from the Affordable Care Act that was put in place by President Obama and his leadership and that congressional leadership, thank goodness. And that could be expanded in the state of Texas if our governor would only allow it to come into our state. Federal dollars that those are part of our Texas tax dollars, our citizens' tax dollars that want to come back in our community. And unfortunately, our governor is not allowing it. With that said, we have funding. We received during COVID. There were financial dollars over $900 million. $900 million came to Harris County. Over $600 million has come to the city of Houston. They all had to put in a plan by 2024 on how those dollars were going to be used. And some of those dollars have already been mandated to go towards health, mental health, things of that nature, along with housing and a few other things. So what I want to do as your state representative is, one, make sure that we identify what are those high needs that are being asked and requested by our community and in need of by our community, and make sure those dollars that we already have from our federal government in Harris County, from our federal government in the city, and what's coming every year in the state of Texas, and make sure they're directed to our community properly and spread out properly. And I think that's the first thing that we can do as far as making sure the dollars are going to the right place. And then we'll talk later about what we got to do ourselves as a community and as individuals.
So I want to reiterate, you said that companies that have 50 employees or less, they're not required to offer health care.
That's
Is that correct?
That's exactly right.
But 50 and above are required?
They're not required. There are a number of ways that they can be relieved from those mandates. But the statistics show that over 50% of our Texans are on jobs where their employers are not required to provide them insurance.
Over 50%.
Over 50%. Over 50%. If you take all of Texas,
that's a lot of people.
We have over 330 million Texans in the state of Texas. You think that's what, over 150, 170,000 people whose mother, father, parent is on a job, whether they're an entrepreneur, whether they're working at a small business, whatever it might be, where they're not required to provide health insurance. And once again, because I have a small business, I have less than 18 employees. So at the end of the day, we utilize the opportunity for the Affordable Care Act. We make sure that the consultants that they have available out there come in and educate my staff on how they can apply. And then I work with other consultants on what kind of insurance can we bring in, even as a small business, that's beneficial to them, that we can afford. And the Affordable Care Act has been a wonderful program. And
it has been.
I believe the expansion.
For a lot of people that I know personally, I don't know what they would do without it, but
and I think the expansion of Medicare, Medicaid, those are billions of dollars available to help communities across our state to improve on their health care. And it's unfortunate that our governor is not concerned about those who are in need at that level. And I really wish our governor and lieutenant governor would remember that they are governing for all of Texans, regardless of political party. And their responsibility is to make sure they're doing the best they can for everyone in our state of Texas. And that's something that we got to change, but right now that's who we're dealing with. That's who we have at the top.
Do you, in your opinion, do you think District 131 is very underserved when it comes to health care as compared to other districts in the Houston area?
Extremely underserved.
Wow.
I believe when you look at our district, which the bottom southern part of our district rides along the Beltway, east and west. 288 kind of splits it down the middle. I would say north, we're going into where we hit Maine, where we hit 59 in the Beltway, kind of Charlestown area, to the east to Sterling, Worthing area. You don't have a lot of major hospitals being built in those areas. We have a lot of hospitals in our medical center, which is our Midtown Medical Center area. We had a boom of hospitals going on in Pearland and Sugarland, south of us. But our district has not received that attention of the growth as far as medical care and new hospitals in our district. And that's something that we got to dive into, because some of these new hospitals and growth of these hospitals are being supported by our tax dollars.
Yeah.
So we want
the money is there.
Exactly.
It's how they're using the money.
We got to hold these entities accountable. I'm talking about our own government entities, to say, if you're going to give them our money, make sure the money comes back to our community for our use.
It only makes sense, right?
It only makes sense.
It only makes sense.
Someone has to stand up. Somebody has to say it. And I believe I'm the individual to make sure that I do it, and I get myself educated on where the needs are, where the money exists right now, and make sure it's properly coming back to the 200,000+ constituents that are in my community, so we can do better with our health care.
Okay, so let's dig a little bit deeper on the healthcare providers. How would you collaborate with local healthcare providers and organizations to strengthen the overall healthcare infrastructure within District 131?
Sure. I think I would definitely start with some of our major healthcare organizations. We have some great organizations: physician organization, nursing organization, first responder organizations. I think one of my responsibilities, definitely as a new legislator in politics for the first time now, is to meet with them and let them educate me on what's going on in the industry, what they're experiencing as an employee in this area, and then also go talk to the leadership. We have CEOs and CFOs over the entire medical center that we have here in Houston, Texas. I will sit down with them. I will sit down with the leaders of MD Anderson and Texas Children's Hospital and the other major UT Health and Texas A&M Medical and TWU. It's time to sit down with them to talk about, one, I want to make sure that I understand how we can help them continue to be successful.
Correct.
And how they can make sure they direct the education they have to provide, the services they have to provide back to this community. Not only from a healthcare standpoint, but I want these young people who are in junior high and high school and college here at Houston Community College know about these careers that are in these wonderful industries in the medical area. So we're going to talk about education and jobs. We're going to talk about taking care of ourselves better and how we can stay healthier, and some of the things that we're already doing and dealing with in our community that's so challenging to our health in the Black and brown community. We got to be honest about it. We got to be honest about how we're going to change it.
Right. You mentioned the younger population, and I don't know. We mentioned it last time, but I didn't put emphasis on it this time. That the younger population, 18 and up, there is definitely a deficit on them coming out to vote. I mean, we have the middle age and the senior citizens are coming out, but there's definitely a deficit in the younger crowd, right? So what can you say to them, the young people that need to register and come out to vote, District 131, talking to you? What can you say to them to let them know the importance of getting registered, coming out to vote, and how that gives them voice? And because they're impacted by healthcare, not having healthcare, they're going to be impacted at some point too, because everyone at some point needs healthcare. So what are some important elements to get the young people to come vote?
You know what? I think, one, unfortunately, for the 20+ years that Alma Allen has been in this seat as state representative, the growth of the voting population has not changed. That 91,000 or so that you mentioned out of the 200,000 that are currently registered to vote, only about, as you said, only about 12,000 come in our primary, 33,000 come in our general.
Right.
That is not, if you look at the statistics, which I went and I researched those statistics, and I'm saying, okay, if my Texas state representative has been here for 20 years, why isn't she having more of a voter registration campaign going on throughout the year, throughout our community to grow that base? And it's not happening. So I'm going to do something about that. And I'm definitely going to start with our young people in high school. because our high schoolers right now are very discouraged about what's going on with their schools, with their school being taken over.
Right.
And I'm reminding them the way we change that is that you become a voter.
Thank you.
We can make a change, and you can be the greatest part of that change by voting.
Yeah.
So with the young people, when it comes to voting, we're definitely going to address that and work with them and work throughout our community, throughout our high schools, which we have about 5 of them that are zoned or in our district.
Yeah.
But when it also comes to the young people's health, one of the things we got to be honest about is, we can just look around in our own family.
Yes.
I mean, as a 16-year-old, 18-year-old, 25-year-old, look around to some of our aunts and our grandparents and even our parents. My parents right now are in their early 80s, right? And look at some of the health challenges they're currently having.
Yes.
We got to be honest with ourselves and look and say, okay, my dad has COPD, right? I'm honest with myself and looking at that and say, you know what? I don't want to be in that position. We got to be honest in saying those things. What things can we do to say, you know what? I did something to at least give myself a better opportunity to not be in those positions. Whether it's what we eat, whether it's what we're smoking, whatever it might be, we got to be honest with ourselves. Do we care enough about ourselves? Do we love ourselves enough to take better care of ourselves and our family members?
Yes.
And you know what? I believe the young people will have such a great effect on those older people, their parents, their grandparents, because those parents love those children more than anything.
Yes, they do.
And I think by those young people being that one who's educated, encouraged, they're going to encourage our seniors and our parents who are still in our workforce. And we're gonna come up with that program and that plan and start implementing some healthier living.
Yes, we need to do that.
Yeah, I really believe.
We need to do that.
And it's there.
Yeah, and I also want to emphasize to the young people 18 and up that just because you're young does not mean you will not have a medical situation.
Yeah.
As Mr. Guillory stated, you can look around at your parents, your genetics, who your blood members are. And, sometimes, I'm not going to say always, but, that could be a dotted line to what could happen to you guys in the future. And you don't have to be 60, 70, or 80 for it to happen. It could happen at 20, 21, 22. So getting out to vote, voicing your opinion is critically important, because never say, oh, that'll never be me. Okay? Because, never say never.
I posted just today the statement that Tupac made, in his rap about we got to change the way we eat, change the way we sleep, change the way we treat each other, right?
Definitely.
He was a poet. He came at a time when we really needed him and wish we still had him here, but we have his music, and I tell you, those are some things that we got to really preach. And we really got to make sure it's echoed throughout our community.
Yes.
Listen, we got to be responsible for us.
Yes,
I'm going to say it right now, and I'm going to tell everybody that. I really believe that it's going to start with us. And when I see that we are working together to do the best we can for ourselves, and I don't see my state doing what it should be doing for my community, I want you to know that you have me as that fighter to make sure that we get what's due to us. And we will go together to Austin. I will take you all with me. We will make sure they hear our voices.
Yes.
So I'm looking forward to being a leader in that effort, and I'm looking forward to being a follower when it's time to be a follower with those professionals that know more about this than I do. With the women and men who've been through different illnesses that I know nothing about. In my community, by the way, 50% of the medical deaths in our black and brown community, they say I think it's 26% is cancer, 24% is heart disease. Over 50% of those deaths are lead, heart disease, and cancer. So once again, we got to educate ourselves on how we can prevent it, what we can do better to make sure that, if it's in our bloodline, what things we can do to get some early testing. And listen, we got to get out, exercise, walk, talk, advocate, prepare. We got a lot of work to do, but it's going to be a fun journey, and I think we're all going to be very proud of ourselves and what we're going to achieve.
Yeah, that's great. I have a lot of medical staff, nurses, doctors, and actually patients that want me to do a full panel on healthcare and what's happening in the medical industry, because they all, from some perspective, whether it's internally or externally, they all have a story to tell.
That's right.
So you really would be surprised about what's happening in the healthcare and the medical industry. You'd be floored. So yeah, I look forward to that segment. It's gonna be a jaw dropper.
And we're gonna have a lot of time to do that after we finish winning this primary election, which is between February 20th and March 5th. Between March 6th and the middle of November, we got a good 8 months.
Yeah.
We right now trying to cram it all into a couple of months. But just think about how much we can do over an 8-month period and really getting out there in the community, getting those professionals to the table and the community members in the table and really brainstorming.
Right.
All of us really brainstorm. It's going to take us all.
Yeah.
It really will.
Yeah. Remind everyone of those dates again.
Sure. The primary election for state representative will be February 20th. Through March 1st is early voting, and the final day of voting will be on March 5th.
Got it.
So please find out where your polling location is located, and you can go to the voter registrar's website and find out where your polling location is for your community. If you're registered to vote, please confirm that your voter registration is up to date. You can also go to your voter registrar's website. By the way, League of Women Voters.
Yes.
I've been talking about them so much. They have a fantastic website. Their website directs you to all these different sites that'll specifically talk to you about updating your registration and getting a mail-in ballot application.
User friendly.
They do a fantastic job. So I would recommend that you all, men and women, check out the League of Women's Voters website and get some direction if you need it. But be registered to vote. Come out and vote. I really need your help. I really need your support, and I'm ready to work with you. But I got to get voted in first. So don't stay home, because if you don't vote, then, as they say, if you always do what you always done, you always get what you always got. And unfortunately, you don't want to get Alma Allen again. You don't want a 6% success rate on bills coming through our community. You don't want $30 billion held up at the state of Texas that's not going in to support our schools. You don't want 18 D and F rated schools in our school district anymore. There's so much we have to do, and there's so much that our current state representative, Alma Allen, is not really telling people the truth about how we are really falling behind and how we're not getting our fair share of what we should be getting in our community. And I'm going to change that.
Yeah. Okay, that sounds good. Let's talk a little bit about technology. In your opinion, what role should technology play in advancing healthcare services, and how would you ensure equitable success to these technological advancements in the community?
Well, I definitely think having those roundtable discussions with those organizations of men and women in the medical industry could help me better understand and know about, because I see what you all see on the TV and in the news, and what we read about the news about all these advancements in technology. And we're already experiencing them, from when we go to our doctor now, from when they send us all the emails before we can get to the office.
Right.
Once again, I have a father that I've spent a lot of time assisting my dad since he's been having COPD for about the last 4 or 5 years. And I see how technology is playing into his appointments, his registration for his tests and all these different things. And my father didn't work with a computer when he was employed, right? So one of the things I think we also got to do is we have to speak up to the medical industry. I know they're trying to be as efficient as possible, save as much money as possible, and unfortunately charge as much money as possible. And we got to have a talk about your cutbacks that you're doing, and forgetting the fact that these are men and women that are 70 years old, 80 years old, some 90 years old, and they don't have the individual at home that has the technology expertise, they still need to pick up a phone.
Yeah.
They still need to be able to call and ask some questions.
Right.
So I gotta ask the medical industry, I need you to slow some things down and make some effort to make sure that our seniors have the opportunity, one, to get the information they need, because they're not going to get it all by email, because they're not on email all the time.
Right.
Make sure we're still giving them access to get the information they need, the health care they need, so on and so forth. I understand over the next 20 years, those others coming along, and they're going to be seniors, they will be probably a lot more well-equipped to deal with that. But I don't want this industry to immediately shut down our seniors and not give them proper access to get proper education and proper care.
Yeah.
We got to do something about it.
Technology can be a good thing, and it can be a bad thing.
That's right.
Because a lot of people are using technology incorrectly. That would be the crooks and they're using technology to throw off the older population because they're not as savvy from a technology perspective as they should be. So it's good that it helps out. It helps to streamline a lot of processes, but it's also it's bad as well if our seniors are not prepped and ready to handle that.
We have to make sure everybody's taking some fair steps and recognize that not everybody is there yet.
Yeah.
We'll all get there, but they're not yet there yet. So we're going to do some things about that. We're definitely going to speak up about that and make sure that, because once again, those industries are being well funded by our tax dollars and federal dollars. So we expect them to do some things to make sure that those people who pay those dollars are well taken care of.
Yeah, we need that. Definitely need that. Let's talk about policies a little bit, okay? Just a little bit.
Sure.
What policies would you advocate for to address the rising healthcare costs and make healthcare more affordable for everyone in our community? So we want the good healthcare costs, but we don't want to compromise the service that's provided within that policy.
Right. I think that goes back to the Medicare, Medicaid expansion that's available to us that could help drive down costs, put more people in a position where they can afford insurance, and it could help pay some of the costs that these institutions feel that they are burdened with, and they have to pass that bill on. Our dollars are sitting at the federal level waiting to come to our state to help take that burden off of our pocketbook. And our governor is not allowing it into our state.
Why?
You know what?
Do we know why?
From my opinion, I believe our governor and our lieutenant governor and some of the reckless Republicans want to keep us in the position that we are in. Some struggling, some challenged, and and I'm saying that just by their efforts, just by the things that they're doing or not doing. So, and you know what? In all honesty, I don't care why they're doing it. I just need to stop them from doing it.
Yeah.
So it's gonna take individuals like myself, not only Democrats, by the way, that I know are in huge support of expansion of the medical funding that could come and support our community. But there are also some Republicans who are already speaking out, especially a lot of Republicans that represent some rural counties.
Okay.
There are a lot of Texas rural counties where, these men and women have had jobs that they've been making $25,000, $30,000, now retired. They can't afford to come to Houston and Texas Medical Center to get this cancer treatment and pay that cost. So what you're seeing is an uprise of those who are middle class and those, unfortunately, who are low middle class and those who are really in poverty. That even Republicans have these individuals in their district as their constituents, and they're saying, we got to do something about this. We had Republicans stand up just recently when Governor Abbott and Dan Patrick tried to push the private schools and push our tax dollars, our public tax dollars, into funding private schools. And those Republicans in those same rural districts stood up against that. I think we have some partners there. We may be the minority in the Texas House as Democrats, but if we're smart, and if we work this correctly, we can work with other people who are not in our same party, and we can get some things done. Yeah. We can get some things done. There's a way.
I agree.
There's a way.
Some things need to be done.
Yes.
Need to be done. Have you seen in the medical, in the healthcare industry that there's a delta between the type of service that patients get if they have a certain type of insurance.
Right.
This insurance is better, so we're going to treat this patient with everything and give them everything they need, but this insurance over here is not as good, so we'll just give them the minimum and, you know, send them on their way.
Listen, I've been
not fair.
I've been in hospitals where I've gone to see family members and friends, where I've taken family members too because they needed to go for some emergency care. You know, I've seen the hospitals where people are in the hallways on beds, right, and sitting in the waiting rooms, jam-packed, and they got the blankets and pillows right there in the waiting room because they can't. So you're right, that disparity exists. That's no doubt. Can we do something about it? Yes, we can.
Okay.
Can we move that needle? Yes, we can. It's going to take someone like myself to organize those other state representatives to say, listen, you may be living in the Heights, or you may be living in upper North Dallas, but I want you to know that this exists in our community, and these are still your Texas residents. These are still citizens of your state.
Right.
And listen, when we have those kind of disparities where people aren't getting proper medical care, and people aren't able to take care of their family when their family needs proper medical care, you know, people will go to extremes to save the life of a family member.
Right.
And what I'm trying to tell the haves, that listen, the have-nots will be at your doorstep.
Right.
Just trying to make sure that they benefit and take care of their family. So don't let that happen.
Right.
We don't want to see it happen.
Right.
There is something that you can do. The options are there. The funding is there. Let's manage what we're spending now with the hundreds of billions we're spending right now to make sure we are properly using this money for the benefit of everybody. And like I said, I'm not only going out there and fighting for proper funding to come to our community. I'm going out there to talk to my community how we're going to better take care of ourselves.
Right.
So we have to use less medical care, and we can stay out of these hospitals and out of these emergency rooms as well.
Yes.
We got to have that discussion.
Is it fair, or would I be going out on a limb to say that there's a bit of complacency going on currently with the current incumbent for District 131, that it's just not, the passion is just not there anymore for the community?
Well, I think a lot of the voters that I go out and door knock, I go to churches, I go to civic clubs, there are a lot of people who just feel, listen, this has been this way for this long, I just give up. Right?
They're just comfortable with the way things are.
Well, it's not so much comfortable. I think they've just kind of just lost the fight, lost the will to fight. You know, you just and they've gotten some pebbles here or there, and some things have come down the pipeline, and that's why a lot of our politicians have been able to stay in office for so long. You know, they pad the pockets and the tables of those that they know are coming out and voting. And if those who are coming out and voting, and majority of them, by the way, 65% of them are seniors.
Right.
So if you pad the pockets of just those, or if you make sure that the needs of just those are semi being met, and they continue to keep you in office, what do you care about the other 75% that's not voting? They gonna get what they gonna get, and what they not gonna get doesn't matter because they can't vote you out because they don't vote.
Interesting.
So you gotta recognize what the politicians, and I'm saying some of them because not all of them, are not out there really hustling and trying to do a good job. But my reason for getting to this, after being in business for 26 years now, I didn't want to leave my business full time to do this. I did this because what I saw was there was so much not being done, and somebody needed to do it. And unfortunately, as I say to people, I thank Alma Allen for what she has been able to achieve. But there's so much more, from healthcare, housing, education, jobs, criminal justice, small business, that she has scratched the surface on. And
you have plans for all those areas.
I have plans for all those areas. And you know what? My plans aren't just James Guillory's plans. I'm James Guillory, who wants to reach out to those industry professionals and leaders and those people who work in those industries to say, how can we do better? How can we perform better? What's going on in your industry and in your job that we can work on to make it better for you, that you can enjoy your career, enjoy going to your job, enjoy the retirement when that comes up. We got to have that discussion. But once again, Miss Allen doesn't have the energy to do it anymore. Not only that, her protocol is to send out a few staff members at different things here and there and keep her staff out here and there. Listen, we're in the state legislature every other year for, let's say, about 6 months for a regular session, 5 or 6 months. And it may go over and the sessions may get extended. But listen, Austin is 3 hours away. Okay? State legislator needs to be able to get in the car, get on a bus, get on a plane, come to these events, get your butt back in Austin. We got work to do. So I look forward to having her at the table with me as we continue to work with the community. I hope she will share the knowledge that she's been able to build up over the last 20 plus years and 40 plus years as an educator. But you just got to say 40 plus years as an educator and 20 plus years as our state representative, and 18 of our schools are DNF schools from elementary, middle school to high school. You just got to look at it and say, you know what? Somebody else needs to try to do what I haven't been able to do. And she's not going to say it.
And be supportive of that, right?
Well, you know, not everybody is considerate enough to say, you know what? I've done a good job, or I've done the best that I can do. Not everybody is willing to say, we need a succession plan in place. So we properly prepare that next person and that next generation to lead so the ball doesn't get dropped, so that we carry it on and we build on it. Unfortunately, that is not the attitude of Alma Allen. I've been on probably about 4 to 5 panels while we've been campaigning over this last couple of months. And I have brought the same statistic to every room with Alma Allen sitting beside me. She doesn't have a reason why it's there. She just wants to tell everybody, I still need to go back to the Capitol because I still have more things I want to do. That's not an answer on how you're going to fix what still hasn't been fixed over the last 20 years. If you keep doing what you keep doing, you only get an average of 1 bill passed per year. What do you leave the 200,000 constituents that are counting on you? So this is not about Alma Allen. This is about a community I love, a community I grew up in. I've gone to school here. I've been educated here. I've run my business here. My family has run their business here since 1974. It's important to me that we stop falling behind. It's important to me that the communities here stop looking like communities where people are abandoning them just to go to Pearland and Sugarland and Katy. We've got to make that change. We got to stand up and make sure that the revitalization is taking place in our neighborhood. The safety is there in our neighborhood. The schools are good schools in our own neighborhood. We can do that, but it's going to take all of us. And the first thing you got to do is vote the right person in to start that effort moving forward. And I'm that person, and I'm asking you for your vote.
Okay, so the upward trend has to start somewhere. The change has to start somewhere.
Most definitely. Most definitely.
Okay, let's talk a little bit about community engagement.
Yes.
How do you plan to engage the community in decision-making processes related to healthcare policies, ensuring their perspectives are considered and their perspectives are valued?
It goes back to my point about first engaging with those industry professionals. And it's now taken not only the knowledge that they have relayed to me and help educate me as well, it's now taking that knowledge and them and say, you know what? We have 5 high schools in our district. There's thousands of you. Let's split up and make time to go to those different high schools and educate our young adults so that they're better prepared, right? Let's take some of you. We have over 50 plus churches in our community. Let's make sure that we're a part of the engagement of that church body, which is one of our strongest institutions in our community. And make sure that, listen, the nurses and the doctors are in those same churches. You know, we can draw them in right there. And we can, once again, it comes down to educating, sharing, listening to them. And then it also comes down to that funding. I talked about the over $900 million that's at the county and $600 million that's at the city that have come down, federal dollars.
Right.
We got to take those same city council members, that same mayor that we just elected, that same county commissioner that we have in our district. We got to bring them to the table also, to that same community, civic clubs, the churches. We got to make sure that when we're identifying that the challenge is something that the city can help with, or the county can help with, or the state can help with, we are there to listen to find out what powers, what things can we do in the seats that we have been entrusted with to help this community out.
Yeah.
It is time for us to dialogue with one another, talk with one another respectfully, and not only that, care about one another. You know, we unfortunately, I believe, have gotten to the point where so many of us said, I'm taking care of me. I'm looking out for me. I'm taking care of my household, and I'm ready to go on vacation, so on and so forth. We got to come back to our roots of looking out and taking care of one another. It's a blessing so many of us have come to a point where we got nice houses, nice cars, nice jobs, all these good things. But I don't want us to forget about those young people coming after us. I don't want us to forget about those seniors who unfortunately may not have a child, a family member that can be trusted to help them with all the things that they're dealing with.
And so it's a lot out there.
It's a lot.
Some people don't have anyone.
That is exactly right. So I'm encouraging, and that's why I start with my young people too in school. I'm encouraging them to give back. Make this your goal, or one of your goals, to be that civic leader, that servant leader, and to really help out. And believe me, as I tell them, you're going to feel real good about yourself.
Yeah.
It really does fulfill me to know that I'm able to do something, or at least bring some people together that can help somebody who's in need.
Okay. I have a question for you. How do you feel about those constituents and those voters out there that say, my vote's not going to count? How many people, you thinking in your head, how many other people are saying the same thing? That number could be huge if everybody's thinking the same thing. So how do you address those people out there that say that my vote's not going to count? It's just my vote. I'm not going to the polls.
Right.
What do you say?
Well, here's what I would say, and I would use this kind of a generational split. I would first let some of our young people know, maybe those who are in their 20s, 30s. I want you to look at your rent bill over the last couple years, 2 or 3 years. And I want you to look at that rent that's been going up by $300, $500, $700. And I want you to realize that you may think that bill is all from your landlord, but there are some expenses, there are some taxes, there are some things that are coming through that landlord, and that expense is being passed on to you. So when you don't go and vote to make sure that the pressure of expenses that go to the small business and the large business and your employer, when you don't go out and vote to make sure somebody's making sure those pressures aren't properly managed, then they're going to do nothing but leak down to you. So I want you, and I'm just trying to hit them where they at, right? I want them to understand that when you're now going to college, and now you're paying over $25,000, $30,000 a year, when at one time it was $5,000 to $12,000 a year, and now you got all this debt on your hand just trying to get a good education and get a good job. Guess what? That cost is allowed by the state of Texas. The state of Texas that funds these public institutions is still allowed. They're giving hundreds of millions of dollars to these major colleges and universities, and still your tuition is going up by 20% every year. All while your pay is not going up but about 3 to 5% a year. So I am trying to educate even the young people. You don't see it on the surface all the time coming in a bill directly to your house from the state of Texas. But it can come through so many different avenues, and at the end of the day, the bill still belongs to you. Whether it's your rent, whether it's your education, whether it's a cost of a car, which should be $300 to $400, which is now $600-700.
Right.
Whether it's an insurance policy that used to be a 1-year policy that used to go up by 7 or 8%, now is a 6-month policy going up every 6 months by 20%.
Exactly.
So I want to educate you. If you want these things to get under control, be manageable, you need a fighter for you. And I am that fighter. And if you don't go out and vote, and you let this other person win, who does not know how to fight, who has a 6% success rate in getting a bill passed at the state of Texas House, then you are stuck with the same thing every year, and you're struggling, and you're not able to save, and you're not able to prepare for your children, and you're not able to prepare to go. Listen, the American dream of getting a house at 25, 35, 40 years old is very difficult right now.
It is.
Right? So I want, and I harp on the young people. I can talk about some older people in the workforce and even some retirees, but the majority of the ones that's not coming out and voting in our district are those 55 years and younger.
Right.
So I'm trying to make sure they understand, as good as you think it is, I want you to know it could be a whole lot better if you had better representation, and representation that's willing to sit down with you and say, what are your thoughts? What are your ideas? What are your challenges? How can we come up with some options and some solutions so we can transition it into a bill, so I can go and get support from not only Democrats but independents and Republicans, so it gets passed, so you benefit. So it's going to be a journey. It's going to be a fight. But I tell people all the time, I look back at what I've already gone through in my short time on this earth and very thankful for it. I was built for this. I'm ready for this, and I know the people that I have surrounding me, the staff that we have, the volunteers that we have. It's just amazing how many people out there, and they're ready to help and ready to work and ready for change. And I'm ready to bring it.
So, long story short, very good answer, but if you're looking for change, why not go out and vote? What is it going to hurt, right?
Well, and I'm saying if you don't, you are hurting yourself and your community, because plain and simple, the Republicans and unfortunately the extremists in the Republican Party, which some of them are Republicans, they're just extremists, are going out and vote because they have realized that they can get their way if they control leadership on the political stage. They have found out that my way of getting what I want, no matter how crazy it is, how ridiculous it is, I can get what I want if I vote for the person who does what I want them to do. So you have to vote. Listen, not everybody was, I wasn't alive at that time when the Dr. Kings were fighting for our rights. The Barbara Jordans were fighting for our rights. So I understand there's many of them, even my generation and younger generation, that just don't know about that. But listen, if you can get on YouTube and you can look at everything else, I mean, I learned a lot about what happened before I even came onto this earth, just by looking back at the marches and the speeches and the legislators like Barbara Jordan that came before me and what they did. I mean, I look for people who have done great things and good things to find out how you did it, what did you have to go through to accomplish it, so on and so forth. And I'm trying to encourage our young people to look for those kind of people, aspire to find out more about them. Know your history, and listen, vote, get involved, be part of your community. Don't just live in it and use it. I need you to nurture it, care for it, look out for it, and grow it, and make sure that it's well taken care of. and that's what we want to encourage people to do. And listen, I want to see the Black and brown community elevated. I'm looking forward to the day where we hear less and less about poverty and low income and the struggles that literally I have heard all of my life. And it's so consistent and repetitive that you hear some of these things, and you see it in some of your own family members. And I'm going to be honest in talking about it and making sure we all talk about it.
Yeah.
We need not run away from the truth about what direction our community is going in or has gone in, and how we need to do better.
Right.
We got to do a better job at that.
Yeah.
We're going to do a better job too of being a part of our young people's life in middle school and high school, so we can help them before they get to the point where we're ready to incarcerate them.
Right.
You know, I know this is a little bit going off of healthcare, but I'm just saying it's so intertwined.
It is.
It's just so much.
Big picture.
Because when you're mentally healthy, when you're physically healthy, when you're capable of providing for yourself and your family, when you're educated, you can do so much better for yourself, for your family. I want to see low income go to middle income. I want to see middle income go to upper middle income. I want upper middle income to go to wealth and riches, right?
Right.
We all can see all boats rise.
Yeah.
There's no reason why we got to leave anybody out.
I agree.
So
knowledge is power. Knowledge is power. And I want to tack on to that by saying that this could possibly impact our children as well. Speaking to the younger people out there, this could impact you and your children, because a lot of them, 25, they have kids. They have children already, 2 years old, 3 years old. So if you're not thinking about yourself, what you should be, think about your children as well. And put someone in office that's going to actually work for you and make some things happen. Critically important.
Right. Stop letting your grandmother be the one that votes for the family. Stop it. That is what's happening.
Right.
Everybody is letting their grandmother go to the polls or send in her ballot from home, a mail-in ballot. Stop letting your mama and your grandmama vote for you. I'm talking also to my men out there.
Yes.
Okay? I mean, listen, we are voting at the lowest rate possible. Okay, but you all are working hard. You're trying to save for your family, for your retirement, and you are not doing your job to make sure that the laws that they are making in the state of Texas is not going to wipe out that retirement from your pocketbook. So you have to be more responsible. I'm talking to my men right now, and we're going to have some honest talks.
Yeah.
We're going to do better as parents. We're going to do better as fathers. We're going to do better at healthcare. We're going to do better at voting. We're going to do better at going to these schools together. We're going to do more than just go to the basketball games and football games.
Yep.
So listen, I fortunately have my mom and my wife and my fantastic team to make sure that I work and focus on our women issues and our issues for our young girls.
Yes.
Listen, I got 5 girls, by the way, so you better believe they're not gonna let daddy forget about what they need. But we're gonna have some honest talks. We're gonna have some and our reason for talking is to come up with options for solutions.
Yes.
That's what it comes down to.
Solutions.
We're not coming to argue, fuss, and fight. We're coming to put it on the table. What's the problem? What are the options? What's the solution? Let's go get to work.
Yes.
And it won't all be done with a bill. Some of it has to be done with our efforts as citizens.
That's correct. Yeah. We're almost at the end of our hour, but I have a question that came from the town hall. One of the people here, they want to talk about healthcare professionals, the shortage of healthcare professionals. What steps would you take to address the shortage of healthcare professionals in our community, and possibly improve the recruitment and, more importantly, retention of those healthcare professionals? Because they're under a lot of pressure, they're seeing a lot, they're under a lot of stress. What can we do to make sure we address the shortage?
I think the first thing we can do, and I've already started with my round table, and we've already talked about healthcare and how we're gonna get in contact with our community. Now let's talk with our community with those same professionals and talk about all the wonderful opportunities that exist in the healthcare profession. Let's talk about what's required or what's possible with a 12-week certificate, 12-month associates, or an associate's degree or a full degree. Let's lay out for these young people all the opportunity, and not just the young people. I mean, I would just say even our younger workforce that's 25, 35, 45 years old, they might be looking for a better career and a new career. So we need to get out to them and let them know these are great opportunities, and this is what they are. You know, I was recently, this is a little bit off of healthcare, but I was recently endorsed by the Houston Police Officers Union. This union, when you go out and meet with them, they have a table. I mean, it's this long table, and it probably has to have on each side about 20 different people on it, men and women, and they represent different divisions of the Houston Police Officers Union. And I never knew all the different divisions that go along in the criminal justice system, and I bet you that exists also in our medical arena.
Most likely.
So I just think about those professionals are already out there. They want to share that knowledge.
They do.
We got to bring them in, and we got to educate not only the young people, the existing workforce, what exists, what opportunities, what it takes to get it, and not be afraid to step out on faith and get yourself educated to do it. Because we need you there. We really need you there.
We're also going to address mental health. We really, really hope you have a plan to address because mental health is really a thing. And you know, for a while, people kind of brush it under the carpet. Oh, it's nothing. But mental health also needs to be addressed. So we really hope you have a plan to address mental health in our healthcare industry.
My mother, by the way.
In closing.
And my mother, by the way, was a counselor, family therapist, family marriage therapist, by the way, for well over 25 plus years. When she went back for her second career, went back to college and got her master's in that. So healthcare, mental health is something that will be part of that overall strategy. Because we definitely want to make sure, like I said, healthy body, healthy mind. We're all going to benefit, so we have to help. And we got to talk about what's leading to some of the challenges in mental health. That we can make sure that we keep from going down that path.
Try to alleviate them.
Let's try to alleviate, eliminate where we can. And help where we need to help, where it's just, hey, if it's God's will, and that's what that person has to deal with, then let's help them be the most productive person they can be.
That is amazing. Again, thank you so very much for answering all of my questions on healthcare and the questions of the audience and the questions of the one that sent me messages on social media. We want to thank everyone for joining once again online, on live here at the actual town hall meeting. And again, I want to remind everyone that today's episode is being sponsored by James Guillory for Texas 2024. Go register to vote, please, District 131, and all the other districts too, but specifically District 131. Get out there, get registered to vote, and let's get someone in office that has the mentality of together, we will.
We will.
All right.
Woo! Yeah.